Nebulizer is commonly used to administer medication for loosening secretion and opening up of the airway. It can also be used to administer antibiotics. Prepare your medication according to the doctor's prescription. Inject it into the nebulizer chamber. Connect the tube from the nebulizer machine to the nebulizer chamber tip. Connect the nebulizer chamber to the T connector. Remove the HME and put the T connector with the chamber in the circuit. Switch on the machine and keep the chamber in an upright position to prevent spillage. When medication is completed, remove the chamber and put the HME back. Ventilate as usual. When the patient is not using the ventilator, connect the chamber to the trach mask and strap it around the patient's neck. Rinse the chamber with cool boiled water, then air dry and keep it in a container. You can also use oxygen concentrator to nebulize medication. Connect the nebulizer tube to the oxygen concentrator. Set oxygen flow at 4 to 6 liters per minute. Oxygen will drive the liquid into tiny water droplets. Inhaler puff or MDI, also known as metered dose inhaler, is commonly used for medication to open up airway and treat inflammation. If the patient is using a ventilator, remove the HME and replace it with the inhaler connector. Rotate the arrow towards the patient. The opening of the inhaler connector is at the side of the arrow. Shake the ampoule well and connect it to the nozzle on the arrow. If the patient can coordinate, ask the patient to breathe in and puff the inhaler at the same time. Otherwise, puff the inhaler when the ventilator delivers air. Remove the connector and replace it with HME. If the patient is not using a ventilator, use a spacer for the inhaler puff. Shake the ampoule well and connect it to the chamber. Coat the chamber as recommended by the manufacturer. Connect the chamber to the tracheostomy tube. Instruct the patient to breathe in and puff the inhaler at the same time. Allow 3 to 5 breaths before the next puff. Administer the prescribed number of puffs. Thank you for watching. For more information, contact HVRSS or speak to your doctor today.